Did you know that shoulder pain and injuries make up nearly 25% of all visits to physical and occupational therapy? Tonight we're going to explore why and how you can prevent falling into that statistic. Hi, I'm Katie Wolfley. I'm a physical therapist, and tonight I'll be joined by fellow physical therapist Chris Ponichtera and occupational therapist Jill Katz to teach you how to keep your shoulders healthy and free from pain or injury. Admittedly, we're all at different starting points when it comes to shoulder pain. You may be experiencing on-off minor pains, constant flare-ups, or be recovering from a surgery. While tonight is all about shoulder health, it's always important to listen to your body or speak to a physical or occupational therapist prior to beginning any program. In tonight's class, we will offer an overview of shoulder anatomy and common problems that can occur. We'll unveil strategies for lifelong shoulder health and learn practical strategies for everyday care for your shoulders. As we progress through tonight's program, please put any questions that you have in the chat. We will cover them later during our live Q&A. And without further ado, let's bring in physical therapist Chris Ponichtera and occupational therapist Jill Katz.
Hi, I'm physical therapist Chris Ponichtera.
And I'm occupational therapist Jill Katz.
And today we're here to teach you about the shoulder. Before we start talking about the shoulder and what it does, we have to understand the anatomy of the shoulder. And really, when we're looking at the shoulder joint is a complex of bones that move together. Now, the three main ones that we're going to reference today are here. First one is our humerus, which is our arm bone. That connects to the scapula or the shoulder blade. And what that does is that forms a nice little joint with the ball of the humerus. That top part connects to the inside part of the shoulder blade or the scapula, together forming a nice ball and socket joint. Over the top of that shoulder blade or scapula is the collarbone or the clavicle, important for where different muscles work and work through. The shoulder blade of the scapula works with the middle part of our spine, known as the thoracic spine. How the thoracic spine moves, which is important for rotation and extension and being upright, influences how the shoulder blade moves. A lot of the time when we talk about shoulder pain and shoulder difficulties, the shoulder doesn't move as it should because the scapula is limited. Now the scapula becomes limited because the middle spine or that thoracic spine that forms a joint with it is stiff in the first place. Now that's relevant because when we talk about the thoracic spine and how that relates to the shoulder blade, posture is what we think of. So that being upright, our nice extended posture when we're sitting, we're not flexed forward, we're staying nice and upright. A lot of the times we see patients in the clinic who have shoulder pain because they live in a world where they're flexed or their thoracic spine is in a bad position. That limits how the shoulder blade can move as a result of that, thus leading to difficulties and pain in the actual shoulder itself. With how the humerus moves, it's very influenced by the shoulder blade as it forms a joint with it. So you might have heard of the rotator cuff before. The rotator cuff is a series of tendons that connect the shoulder blade to the humerus, like that. You have 4 of them. 2 of them are on the backside, and they run up like this. 1 of them is on the front and runs up like that. The 4th one is a little bit different from the other 3, and how that works is you have a tendon that starts on the inside part of the shoulder blade, runs underneath that clavicle, and inserts right on the side part of that humerus. So if my shoulder blade is doing anything less than perfect, if it's doing anything less than what it should be doing, the humerus and that rotator cuff tendon tends to overcompensate. So when people come in with shoulder pain and they tell me it hurts when it's sitting or when they're reaching or doing anything like that, it's because that thoracic spine influences how that shoulder blade moves, and then it compresses that tendon, creating issues with the humerus, making arm pain or shoulder pain. So when we're working on rehabilitating someone or making them feel better with shoulder pain, everything we're working on is getting the mechanics of the whole complex moving better, meaning not just the actual arm bone. It's the shoulder blade and it's that thoracic spine. That's what we have to get to the bottom of first before we can address the pain that we have in the actual shoulder. So the significance of shoulder anatomy is when the humerus sits not so nicely in the actual shoulder blade itself. It's an imperfect joint, meaning where the actual humerus, the arm bone, where that sits inside the scapula is not a perfect fit. The humerus is actually a little bit bigger than the scapula is. Think of it like a golf ball and a golf tee. The golf ball sits on the golf tee, not in it. It's more on top of it. So with that said, you need some external support. So we know these are bones, right? Humerus, scapula, clavicle. You need something around the joint that's going to stabilize it. Think of it like a blanket. That's where the rotator cuff comes in. And really, I tell patients it kind of lives like a blanket that lives over the joint like this. It keeps everything nice and tight, because you can imagine if that shoulder blade isn't perfectly aligned with that humerus, that's when things start to get aggravated. We call that unstableness of the shoulder. When the shoulder is unstable and the muscles don't move as they should and the rotator cuff isn't doing the job it needs to be doing, that's when arm pain is created, because now mechanics aren't perfect. If I go to lift or reach for something, my arm is doing all the work, and really my shoulder blade isn't helping out because my rotator cuff isn't stabilizing that joint. So a lot of the rehabilitation of this involves keeping everything nice and tight and locked down. Then you start to work on some of the mobilization of that thoracic spine and that shoulder blade to help the whole system move as it should. So now we're going to talk about some of the most common injuries that we see for shoulders. And now, not everyone's the same. There's a lot of different causes for why these things could happen. But generally speaking, there are some trends that we can follow in terms of what happens and why it's happening. First one that we see is a rotator cuff tendonitis. And you might have heard the word impingement with this too. What that means is that tendon that I referenced earlier, the one that starts on that inside part of that scapula, works its way underneath that space and attaches right on that outside part of the shoulder, that space becomes enclosed. Now, there's a couple reasons why that could happen, but when it happens, the symptoms that we most commonly see with that are anytime I lift my arm up, usually it'll kind of bother that specific space, and it's always that same pain over and over and over again. Pain could refer in the front, it could refer on the side, a little bit behind it, but really I'm pretty good until I get to about 90 degrees at my shoulder, then symptoms come on. That's generally how we look at that one, the easiest kind of way to see it. When that happens, that space becomes compromised that we mentioned. The question is, why did it become compromised? What about the rest of the shoulder complex is making that space stuck and not moving as it should? It's not a humerus problem, it's not an arm problem that's making that tendon angry. It's more what's happening up here. A lot of the times when we don't have good mobility or stability in the shoulder blade or even that thoracic spine that runs right in the middle of that shoulder blade, that leads to overcompensations. The muscles become tight, they become weak. This whole scapula moves improperly, and that tends to put a lot of strain in through there. So to fix that is to really get this moving and to get that middle back or that thoracic spine moving even better. One of the more common ones we see as well is biceps and a bicep tendonitis or an irritation of the bicep. Now, a lot of the times people tend to think that the bicep is really just that elbow flexor. It brings my elbow kind of closer to my shoulder. Now, it does do that, but really the bicep starts up at the top part of the shoulder blade, or at the top part of the humerus, excuse me. So it starts right in here and it works its way down past the elbow. The bicep does two different things. It bends the elbow, it also lifts the shoulder. So likewise with the rotator cuff tendonitis or the impingement that I just talked about, that becomes aggravated when the humerus is doing too much work. When I don't have good movement here, again, overcompensations come in the form of that rotator cuff issue. They also come in the form of that bicep tendon that lives in through there. So again, very similar recovery to that rotator cuff tendonitis for most people, but a little bit different pathology in terms of why it happens and where the actual pain is. Very similar to the rotator cuff tendonitis, it's when I lift my arm up to a certain point or I use that arm, meaning I bend my elbow or I lift my arm up, anytime that that tendon is becoming used, you're going to feel symptoms as a result of that. So to fix that is not to do anything with the humerus, it's more to fix what's making the arm move in the first place, meaning that scapula and that thoracic spine. One of the bigger ones that we see is a rotator cuff tear, and that's really the third classification. So that rotator cuff is really those four tendons that we spoke about that stabilize the shoulder. More times than not, this is traumatic, and more people will have one moment in time where they can remember, I fell, I stepped the wrong way, or I bumped into a door, or I tripped on something. I landed on my shoulder, I aggravated that spot, and since then, that very one moment in time, it's been damaging and it's hurt, right? This comes in the form of weakness. That's the most common symptom of this. And not weakness in the sense of you can get your arm up and it hurts, you can't do it. So if I tell you to lift your arm overhead and you're saying something like this and it feels unstable constantly, there's a fair chance you might be dealing with a rotator cuff tear. A lot of different ways to rehabilitate that. Surgery is one, but we do treat it conservatively with it as well. Meaning it's the same recovery and same idea as what's contributing to everything else. It's more of a mechanics of the shoulder blade and mechanics of the thoracic spine will help that rotator cuff do what it needs to do and heal as it should. And one of the last ones that we deal with is osteoarthritis, or OA of the shoulder, now commonly known as arthritis out there. The cartilage, since this is a joint, the cartilage between that humerus and the shoulder blade becomes diminished. So we don't have as much space as we need in there. Just like any other joint in the body, the knee or the hip or any other joint that has cartilage in it, the cartilage deteriorates over time. That creates compression of spaces in the shoulder. There's a lot of different ways to deal with that as well, but again, very similar to the other pathologies. You really don't worry about the actual humerus, you worry about what makes the arm move, and that's shoulder blade and thoracic spine.
Now that we have a better understanding of the mechanics of the shoulder and what are some of the common injuries that we run into, now we're going to talk about some tips that you can implement in your everyday life in order to help prevent shoulder injuries. So the first one is to keep moving and to warm up before you do activities. So whether you're going to the gym, making sure you're stretching ahead of time, or maybe you're doing yard work or going swimming or doing things, around the house, making sure that you warm up ahead of time. Stretch the shoulder, make sure we keep things moving. Another one is to maintain good posture. So like Chris had kind of talked about before, that poor posture can then lead to things like impingement. So working to make sure that we have our shoulders back, almost like you're kind of pinching your shoulder blades together a little bit and then relax down at your side. Practicing this good posture and then implementing it throughout your everyday life is going to help prevent shoulder injuries also. Another tip is to work on strengthening your shoulders. So we're going to talk about that in a little bit as well when we go through some specific exercises that you can do. But strengthening all of those surrounding muscles that Chris talked about is going to ensure that you keep the shoulder joint and all of its surrounding muscles nice and strong so that your body can help prevent against injuries. Another strategy that you can implement into your everyday life is to make sure that you're taking a lot of rest breaks. So if you're doing activities that are more strenuous on the shoulders, requiring lifting, twisting, heavy pushing, anything like that, making sure that you're taking breaks throughout it. Give your shoulder that time to rest. If you start to notice that, one specific activity is causing pain in your shoulder, sit and take a break and then come back to it. Maybe even try to switch between hands if possible for the specific activity. Another is making sure that you're lifting properly. So trying to hold objects that you're lifting closer to your body, and then making sure that you're lifting with your legs, so squatting down to be able to pick something up versus lifting with your back or your shoulders. Making sure that you're facing whatever object that you're lifting and you're not lifting in weird angles. So if you're lifting a pet, a kid, a box, whatever it might be, making sure that it's right in front of you and you're holding it nice and close. If it is something that is a lot heavier, maybe phoning a friend to see if they can help you lift as well. Another thing is to use a step stool. If you are going to be having to do something that's going to require a lot of overhead movements, so a lot of prolonged lifting your arms over your head, use a step stool. You can use a reacher if it's just to grab certain objects out of higher shelves, but try not to keep your arms up above your head for long periods of time, again without that rest break. Last but not least is if you're carrying a purse or a backpack, try not to carry it over just one shoulder. If you're carrying a purse, switch between those shoulders. And if you're carrying a backpack, making sure that you're carrying it over both shoulders to help evenly distribute that weight across your body.
Your desk job shouldn't be a pain, literally. Picture this, you're sitting at your desk, but you're constantly stiff and sore. And in those long meetings, the real challenge isn't those deadlines, it's that nagging back or neck pain that started 3 months ago. Right, Janet?
Security?
Receiving the right treatment and exercises from a physical therapist will make all the difference, but let's be real, with that packed schedule of deadlines and family commitments, getting to the clinic seems impossible. That's why Buffalo Rehab Group offers virtual physical therapy. From diagnosis to discharge, experience one-on-one care, confidential sessions, and progress tracking right from your home or office.
So now we'll talk exercises, and we'll do some general things, as Jill talked about, postural and just general movements to get the whole complex moving better. Remember, we're really not working on the humerus, the actual arm bone. We're working more on the shoulder blade and the thoracic spine. So these exercises are going to be intended to work those areas most. The first one that we do, Jill's got a ball, and all it's going to be is a nice little rotation between her mid-back and her shoulder blades. And she's doing a nice job of getting her feet moving with it. Her head follows the ball, whatever direction it goes. When you're doing this, you might get a couple cracks and movements throughout your middle spine, and that's a good thing because we're opening that space up. Whole idea being we're sliding that shoulder blade one way, we're sliding it another way. That mid-back rotates one way, it rotates the other way as a result. When I'm prescribing this one, I'm telling patients 20 repetitions is really good. I'd say 3 times a day, whatever feels comfortable. Now, Jill has a 2-pound medicine ball, but if a pillow feels better without resistance, that works well. Laundry detergent bin, whatever you can get your hands on. It's not so much about weight as first, as all we're trying to do is just get some more mobility back throughout the spine. That's the first exercise. Standing would be great, but if you do need to sit, if you find yourself without balance or you need to give yourself a break, we can also do this on the chair. Jill's going to sit up nice and tall in that good posture first, and it's the same idea. She's rotating one way, rotating the other way. The actual exercise of the upper body doesn't change. We're just taking the lower body out of the equation and helping out with balance if you find you need a little bit more help with that. The second exercise that I like to give is a variation of that one. Now, instead of rotating, all we're going to do is work up and down. And again, we're going to incorporate the lower body. We don't have to, and I'll show you a modification, but how I like to prescribe it is Jill goes into a nice easy squat position. She goes low and keeps those elbows straight and lifts overhead or to the point of a discomfort. If you get to about 90 degrees of that shoulder and you feel pain throughout there, that's a good place to stop. You don't have to go through that. I'd like to say about 20 repetitions, only to the point of a discomfort, and then when you're done with that, you take a little break, we can do it again. The modification here is just like the other one. So Jill can sit on the edge of the chair and keep those elbows nice and straight, and we're just going up and then going down. So it's the same idea, that middle spine in your trunk, flexing up, flexing down, flexing up, flexing down. The shoulder blade is moving with it, and thus the humerus is going for a ride too. So everything in the shoulder complex moves as it should. The final exercise that I like to give for mobility is a nice easy muscle contraction between the shoulder blades. Now, what it's doing, and Jill will be doing it this way, her shoulder blades are going to be pulling in. So I tell patients, pretend like there's a stick that moves in the middle part of your back, and it runs between your shoulder blades vertically. You want to take the stick and squeeze it nice and comfortably, and she's going to get a nice pull there, not a pain, but a nice little pull there. She should feel this between the shoulder blades, but there could be a little bit of a reproduction of symptoms in the shoulder. You don't want to squeeze as hard as you possibly can, just go nice and easy and feel that muscle contraction moving through there. Same way to modify this one would be sitting in a chair, nice and easy. As long as we're sitting in good posture, we're sitting up nice and tall, we can do the same thing. Another correction I like to make with patients is make sure that the chin stays nice and tall. We don't let our chin dip. We want to make sure we're in that best posture to promote the best mechanics throughout the shoulder. When I'm giving this one, generally telling patients 10 repetitions, and you can hold it for anywhere between 5 and 10 seconds just to make sure that we're keeping a nice little muscle contraction there, getting some more mobility throughout your middle back and your shoulder blades. Now, once we feel like we have enough range of motion and the shoulder's moving pretty well, we want to work on the strengthening of all those areas that we've talked about before. So we have a couple exercises that we'll go over and Jill will demonstrate for us. The first one is a row, and you've probably done something like this in your life before. What she's doing, and she's using her left hand for reference, we're going opposite leg, opposite arm. So her right leg is facing forward and she's bent in her trunk. That left arm is coming up. But a lot of the times when we do this with patients, we're not trying to bias the tricep. We're actually pulling from that shoulder blade that we were using before with that squeezing exercise. So if you start to feel like your arm is kind of flopping or swinging around, you really want to get back in that mindset of using those mid-back muscles and pulling back that way. Now, when Jill does this, she has a 2-pound weight, but again, we can modify this to be anything. We don't even have to use weight. If you just want to practice doing that without anything, that would work well. You could also increase the weight or decrease the weight. A can of soup, anything within your house that you can get your hands on that you can grip and pull back with is a good way to build up some resistance and strength in that back. Now, when we would like to exercise, we like to keep it functional, meaning the next exercise we'll do is a shelf lift. We want to be able to apply this to your everyday life. So Jill's going to work on it, and she's lifting the weight up and down, and then up and then down. Similarly, this could be like lifting a cup into the cupboard. So again, 2-pound weight, nice and easy to start, and you shouldn't just feel like the arm is moving around. You should feel that shoulder blade coming down, coming back, coming up. So really it's a 3-part motion, down, return, up. So everything Jill's doing, she's doing a really good job of keeping herself nice and tall. You don't want to sacrifice form for this. So if the weight feels like it's too much, go down a pound or don't use any weight at all. See how that feels. Build up into a soup can or a can of peas and then go into weights from there as you feel strong enough. Usually I like 10 repetitions of this, and I do 3 sets just to kind of build up that strength in that entire arm and as well as stability throughout the shoulder. Now the final strength and stability exercise that I like for the shoulder is what we call a chop and lift. And really the name implies what's going on. So Jill has the ball, she's gonna go down and swing up, down and swing up. So it's kind of a complex motion where the mid-back is rotating, the shoulder blades are coming down and then in, and we're going just the opposite way on that loading and exploding out. Also, you can see her foot that's rotating down and coming the other way. So think about a nice diagonal line that works through there. Very similarly as some of the other exercises. Again, we can use a pillow or less weight. It's not about the resistance as much as we feel the motion, and once we feel easy with it and we're getting good range out of it, that's when we start to improve the motion and improve the weight. Modification could be if Jill's sitting. It'd be the exact same thing as what she did with the other ones, where it's the same motion, that trunk moves, that head moves, everything moves in that direction. 10 repetitions one way and then 10 repetitions mirrored the other direction would work just great.
Now that we've talked about rehabilitation of the shoulder, did you know that shoulder injuries are the second most common body part that may take someone out of work? So we're going to talk about some ergonomic changes that you can make to your workday and your workspace to help prevent those injuries from occurring. So the first one is, especially if you sit at a desk all day, making sure that the chair that you're sitting in is supportive. It helps to hold your back up nice and straight, and we want it to be supporting the curves of your natural spine. So definitely having some of that lumbar support in there. If you use a desk, we want those elbows to be at about 90 degrees. We don't want the elbows to be bent up any higher than that, really so that you can be in that relaxed position. We're not having any compression on the nerves in the arms. Another thing is to make sure that your feet are either supported flat on the floor, or if you can't reach the floor, then having some kind of step stool or something that can provide that foot support for you. Another thing is if you use a monitor, especially a desktop monitor, we want that to be raised up about 20 inches or so. You basically want the top of that screen to be at your eye level so that you're not looking up or looking down the whole time, which can cause some strain and stress on the shoulder joint and the neck. We talked about lifting earlier in this program, but making sure that we're lifting with items right in front of our bodies. We're lifting close to the body, not arms extended out. And if something is heavy, asking a friend or a coworker or whoever to help you lift as well. Last but not least is that if you can adjust your workspace, especially if you work standing up a lot of the time, trying to work between that chest and hip range so that you're not reaching too high up or down.
So just to summarize everything we talked about tonight, first things first is we always want to maintain that shoulder health and really be proactive about what we're doing. Exercise in daily care is the most important thing that we can do. We talked about mobility exercises and stability and strengthening exercises to keep our shoulders moving well, even if they're feeling good, because we don't want to fall into one of those categories of shoulder pain that we talked about before.
Implementing the strengthening and range of motion techniques that we talked about, in addition to proactive measures, such as some of the different tips and techniques that we talked about, and implementing some of those ergonomic techniques as well. If you feel like you might need further help with your shoulder injury or pain, schedule with a licensed professional like a physical or occupational therapist for more help.
Thank you for joining us. I hope you've learned something new today that you can take into your daily life and practice. I want to remind you all that as a thank you for being a part of our audience today, you will receive a free 30-day trial to use our health and wellness app, Indy, containing physical therapist designed workouts to get you moving. You'll find a Focus Shoulder program designed to improve your shoulder health with an 8-week plan. Keep an eye out for an email following tonight's class to trail that offer. Next, we'll have a live Q&A with Jill and Chris.
Do you feel like you're slowing down? Feeling older? Like you're out of routine and tired of being tired? Ready to get moving and take control of your health? Introducing Indy. We help everyday people move, exercise, and live an independent life. Indy provides safe, low-impact workouts designed by a team of physical therapists.
We're going to work on balance, strength, and mobility. Get control of our pelvis. We want to get control of that core.
Unlike other programs, you won't be left feeling exhausted, injured, or struggling to keep up. Get moving and improve your life today. Try for free. Visit indymoves.com and get moving.
Hey everyone, thank you for staying tuned through all of the wonderful information. We are now going to go through our live Q&A questions. Unfortunately, Christopher was feeling under the weather, so unfortunately you guys are stuck with just me, Katie Wolfley, and Jill Katz, but we're going to go through your questions and hopefully give you some great answers. But first I want to remind you guys that as a thank you for participating today, we're going to give you another little goodie to take with you. Look in your emails after today's class. We're going to be sending you a code to get a free month's use of Indy, which is our fitness and wellness app. And we have great programs written on there that are actually specific to certain body parts, strengthening, flexibility. There's some yoga on there. We've got a lot of great things, and they're all physical therapist designed, so we know that they're going to be safe and effective for you. So feel free to play into that and see what works for you, and you can stay and use that app afterwards. Also, after we go through some of our questions, if you have additional questions or want more personalized strategies and tips for your shoulder pain, you can work with our virtual physical therapy team. You can use a link that we will share with you in tonight's chat. You can schedule a time to speak with a virtual PT. So hopefully we give you some great answers that you can use, but if you need anything a little bit more personalized, feel free to use that link and chat with one of our great personal virtual physical therapists. All right, so our first question comes from Julie. Julie says, is there anything that you can do for the shoulder when you have severe arthritis other than injections? Will exercise help or hurt? And when I try to exercise, it is very painful. Jill.
All right, so great question. With arthritis, we definitely want to be working to strengthen some of those surrounding areas, but we definitely don't want to irritate the joint any more than it already is. So heat is always going to be really great for it. It's going to send blood flow and circulation to that area, and then really working on some of those exercises, some of the ones that we shared with you a little bit earlier as well, but just staying within that pain-free range of motion.
Yeah, we tend to find that our arthritic shoulders definitely need mobility so that we can try and provide as much space as possible between those two bones, right? That's really the problem. So working through mobility and then providing strength to all those surrounding muscle groups to really kind of help strengthen it up and keep you functional through those regular movements. All right, our next question comes from Vicky. She too says, I've got arthritis in the shoulder. What's the best course of action or plan?
So kind of like we just talked about, using heat is going to be great for it, and then really working on range of motion, and again, staying within that pain-free range.
Perfect. We're all on the arthritis train. Okay. Next question is from Deborah. She says, I was diagnosed with bursitis in my shoulder last August. I'm still having pain daily. Therapy didn't help, nor did injections. Any ideas as to what else would help?
So if you've already tried therapy and injections, potentially trying those again, maybe with a different therapist or doctor as well. You can also follow up with an orthopedic specialist to maybe get some further imaging and see if maybe there's something else going on in there as well.
Lovely. Okay. Our next question is from Hillary. She says, what causes frozen shoulder? I think I can take this one if you don't mind. Frozen shoulder is one of those fun anomalies within the orthopedic world. We do not know kind of exactly what happens or exactly who it's going to happen to. It can come from, say we have a shoulder injury, a break in the arm where we are told to immobilize that joint. Immobility for a long period of time can cause that shoulder to tighten up. It's the connective tissues that surround ball and socket that really kind of pin together, and that creates the frozen shoulder. But there are risk factors that are kind of leading certain people to it, and that can include, it actually impacts women more than men over the age of 40, and anybody dealing with other diagnoses of diabetes or any issues with thyroid tend to be common risk factors as to why we have that happen. But it's definitely something that can be worked through with physical therapy. There is sometimes a right timing for it because frozen shoulder can go for a long period of time, and it follows this fun phase of freezing, frozen, and thawing. So there is an optimal time period for when it is, you're going to get the most out of it from working with a PT. But I hope that answers your question. Okay, our next question is from Catherine. She said, I have a partially torn bicep. What's best exercise for this? Can I throw in some? Yeah. Okay. So with a partially torn bicep, it's not completely gone, right? So there are some of those threads hanging on. Sometimes it can be uncomfortable. So definitely, as anything else, work to your tolerance. But because we do have some of those like missing strands of attachment points at that bicep, you do want to help strengthen other muscle groups surrounding that shoulder to get your best lift as you're moving, right? That bicep is intending to bend our elbow and usually help us lift. So if you can strengthen upper back muscles that stabilize our shoulder blades, work through your bicep strengthening exercises like curls with rotation, hammer curls. Those are all going to help strengthen that bicep specifically, but focusing even more on kind of the slow lowering down with weight so that we can focus on strength training the tendon as opposed to just the muscle itself. That's a really great way to actually strengthen tendon connections, which would be important for that bicep. Do you want to add any, or is that pretty good? No, okay. Okay, so working more of that total upper body as opposed to just the bicep that is limited in its own. All right, next question is from Michelle. She says, I'm not diagnosed with anything specific at this point. However, I have a lot of pain in my right shoulder at night. It's very difficult to fall asleep. What would you suggest?
So with sleeping, a lot of times, depending on the positions and, our shoulder tends to stiffen up a little bit at night as well. So if you are a side sleeper and you sleep on that side that's injured, you could try to prop a pillow kind of on both sides of the shoulder, kind of holding that shoulder in place. If you sleep on the opposite side, you can hug that pillow a little bit. It's going to help just kind of support where your shoulder is resting. If you are a back sleeper, then maybe trying to prop a pillow underneath your shoulder as well. Overall, we want to just try to kind of stabilize it so it's not moving and flopping too much throughout the night.
All right. Our next question is from Lisa. She says, I have a slap tear repair that was done a couple of years ago. What can I do to strengthen my shoulder without causing damage?
So about a year ago, as long as, everything's healed relatively well, most likely, there's not necessarily going to be a lot of limitations there in terms of what you can do. But again, just kind of listening to your body and trying out some of the exercises and stopping if anything's too painful and really keeping it in that pain-free range.
Agreed. And sometimes you find that especially with slap tears when you're dealing with the labrum, you're going to want to work on making sure that you're doing movements where your hands are in open space, so like weighted curls and doing that type of thing, but then also what we call closed chain, where your hands are on a surface. So think about like a push-up or a plank. When you are coming back from a repair of a slap tear, those push-ups can definitely be uncomfortable. So we take patients through progressions where maybe you're standing at a wall, hands on a wall, then working your way to countertop surface, down to the floor, those types of things. So definitely working through those progressions where you're making sure everything is comfortable, nothing is very limited, and progressing up from there. Okay. Next question is from Jax. He said, how do you relieve tight traps as a result of bad posture and shoulder pain? The ever-beloved question of life, right?
So kind of depending on maybe taking a look at some of your day-to-day activities. If you sit a lot throughout the day, taking some stretch breaks, maybe following some of those ergonomic suggestions that we made as well. And then really any of those exercises that are going to work to strengthen some of those upper back muscles and things that are going to work to strengthen some of those muscles that are involved in our posture is going to help to alleviate that.
All right, next question is from KP. They said, I was told if you have back pain not to do full twisting exercises. What would be the modification for that? Which I'm assuming is probably referring to our chop and lift exercise with the ball. So we'll go that route. Just moving your arms or hands up overhead, would those be good alternatives?
Yeah, that definitely would be a good alternative. With that motion as well, most of that movement is going to be coming from the hips instead of the back. So, trying it with making sure that you're moving your hips with that movement. But if it is causing pain in the back, then definitely not pushing it and doing a different variation of it as well.
Yeah, when you're standing, making sure that you're actually like pivoting on your back toe. That's where you're going to make sure that you're rotating from your hip joint, as opposed to if you keep your feet planted, yes, you could end up twisting from your low back. So if you have a known injury or issue with that, you could make that focus point, or even try that option of the sitting, right? But I think also what you're getting at is if I could work through like an up-down motion, yes, work to your tolerance. Don't ever rob Peter to pay Paul. So if you're having a low back injury that's uncomfortable, make sure you're moving within your body's tolerance. All right, next question is from Leslie. If you have a tear in your rotator cuff, will any of these exercises help that? I was told tears cannot heal without surgery.
So it depends. If it is a partial tear, then kind of like Katie was talking about before, there is conservative therapy that can definitely help to build on some of the strength in some of those surrounding muscles, work on building up some of that connective tissue again. If it's a full tear, then most likely surgery is gonna be that only option.
All right. Kristen says, I've begun to have underarm pain. It almost feels like a swollen gland, but it comes and goes. Could I be overworking it? Could be. Kristen, I would ask like what types of movements and exercises you're doing. If there is anything where during a specific movement you're feeling that space be aggravated, stop doing those things. Definitely consult with someone about it. If it feels like it's an actual swelling that's coming and going, I would still definitely get it checked out. There are muscles that live in your armpit technically that are related to the shoulder joint itself, that attach to the shoulder blade, and it's a part of our rotator cuff. So then I would be looking at what certain movements are you doing that rotator cuff would be working, and see if those are implicated as a part of it. But definitely maybe seek out some advice, seek a professional, see what that lump is. But hopefully it is just something that you've overworked, yes, and maybe we need to focus on strengthening some other muscle groups instead. Eric says, how can you decipher whether to go to PT or jump to an MRI, as patients are usually in extreme pain after an acute injury, and PE, which I'm assuming physical exercise, is usually extremely limited? Would you like to?
Sure. So kind of depends. If you're in extreme pain, definitely maybe trying some of those other routes. So whether it's maybe an injection, maybe it's a steroid pack. We're always advocates for coming and trying therapy. There's a lot of different movements that we can kind of work through to hopefully help to alleviate some of that pain. And then we always communicate pretty well with the doctors as well. So if imaging is something that we need to do down the line, we can definitely help you make that connection.
I do feel like some people will tell us that I've waited a week or two already and none of this pain has come down. Then yes, absolutely, we should be seeing someone. Sometimes acute pain can reduce with maybe a couple days of rest and a little bit of ice. But there's plenty of things that, yes, we can do and look at. And sometimes it's quicker to get in to see us than it is to get in to see some of those orthopedic specialists. So if you don't have any access to those types of professionals, sometimes going to see a PT to get their opinion on what might be going on and seeing what movements you can do to either help reduce some of that pain, swelling, and just keep you moving can be a great option as well. Yes, we'll usually kind of give a thought on what we think is going on. If you really want that MRI, absolutely go for it. But it's always, I think, worthwhile seeing occupational or physical therapy to see what's going on before you go that route. They're not cheap, right? Okay, our next question comes from Karen. Any suggestions for sleeping positions with shoulder pain? Either side and back sleeping causes pain. Side and back.
So, like we kind of talked about a little bit before, if you're a side sleeper, if you sleep on your affected side, trying to really cradle that shoulder with some pillows. If you are sleeping on the opposite side, then really trying to kind of hug that pillow a little bit, hold that pillow close to your body. We want to essentially keep that arm from just dangling down. That's what's going to cause some more of that pain. I think you said back sleeper too, right? Is that bad? Yep. So if you are a back sleeper, trying to prop a few pillows behind your shoulder, maybe even right next to it as well. Essentially, we want to just kind of hold that shoulder in a stationary spot.
If you're dealing with like an acute injury too, I'll have a lot of patients tell me that they do feel better like trying to sleep in their recliner for a couple of days until things settle down and then return to their bed with these types of propping techniques that can be helpful for keeping the arm in line with you rather than letting it hang behind you and dangle down into that surface. All right, last question here comes from Joan. She says, no pain, but at the gym doing flies or lateral raises, my shoulder makes an extremely loud noise like Rice Krispies. What is going on?
It's good that there's no pain there. Could be, could be just some popping of that joint there. If it's not painful, then it's usually okay. Could be the tendon kind of getting trapped between different areas. It could really be a handful of things. So I would just kind of keep an eye on it. If it starts to get painful, then maybe follow up with someone. But if it's not painful, then it's usually okay.
Yeah, it could be like you're kind of impinging one of the tendons up in there. It's just kind of gliding over bony surfaces. So when it's not painful, it's okay. Yes, if it becomes painful, seek someone out. Or instead of going straight out to the side, maybe you take your arm a little bit forward to like a 45-degree angle in front of you. If that reduces the popping noise, run with that route. All right, so that finishes our questions. We thank you guys so much for tuning in today. Don't forget you're going to receive in your emails over the next day or so a link for that Indie code so that you can start participating in some of those classes at home on your own time, trying to alleviate any conditions you might be dealing with. And check into the chat for the link to have a personalized session with one of our virtual therapists. And again, thank you for joining us, and we'll see you again next time.